Welcome to the Dallas ISD School Health Advisory Council, otherwise known as SHAC, Orientation Training. This training is divided into 3 sections. This is the 3rd section, and it will cover where you go from here. According to policy BDF Legal, the district must consider the recommendations of the local SHAC before changing the district's health education curriculum or instruction. The Dallas ISD SHAC submits an annual report that provides recommendations that the board must consider. You can access past board reports on the Dallas ISD website. At the first SHAC action meeting, you will have the opportunity to sign up for a subcommittee. SHAC subcommittees meet as needed on opposite months as the action meetings. SHAC action meetings will provide an opportunity for subcommittee reports and recommendations, community presentations, and district updates. Each year, the first SHAC action meeting takes place in September. A proposed calendar of meetings is provided, and SHAC action meeting attendance is expected to maintain continuity of the council. SHAC membership is not short-term. The Dallas ISD SHAC does not limit the number of years their members may serve. For a successful SHAC, they must increase awareness and build internal support, demonstrate the need for community support and involvement, identify champions on the school board, provide recommendations based on evidence-based research, understand budgetary issues involved in recommendations, understand the impact of recommendations in other areas, and have patience. If schools do not deal with children's health by design, they will deal with it by default. SHACs do face some ongoing issues. Often there are misconceptions about the purpose. The primary role is to research best practices and provide sound recommendations that reflect the voice of the entire school community. As a voluntary position, time constraints and lack of commitment are often a factor. Try to plan ahead to attend meetings, and if you are unable to attend a meeting, email correspondence or other virtual communication can be provided to keep you abreast of new developments. Each year, principals and trustees receive a notification about recruiting new parents to serve on the SHAC. Support comes in a variety of ways. Today's youth face very different issues from those of the past. School districts alone cannot meet the complex needs of today's students. A truly coordinated school health plan can actually take less time overall because it reduces duplication of efforts. Funding is limited, but this is an opportunity to look at what is in place and what can be improved. There are funding sources for new ideas to improve children's health. But there is good news. At the national level, the local school wellness policy requirement was established by the Child Nutrition and WIC Reauthorization Act of 2004 and further strengthened by the Healthy, Hunger-Free Kids Act of 2010. Additionally, new guidelines were recently released that provide stricter guidelines for snacks. At the state level, Texas legislation is leading the way for state mandates that address health and wellness. Mandating coordinated school health, requiring 135 minutes of PE at the elementary level, and physical fitness assessments are a few examples of guidelines that schools must abide by. School districts must also make available for public inspection a statement of policies adopted to ensure that elementary students get 30 minutes per day, 135 per week of physical activity, a statement of the number of times during the year the SHAC has met, whether the district has adopted, enforces policies to ensure that campuses comply with agency vending and food service guidelines, and policies on tobacco use on campus. Dallas ISD continues to support the efforts of the SHAC in their mission to develop and sustain healthy school environments. A dedicated position for coordinated school health is part of the Health and Physical Education Department, and internal communication is provided to appointed CSH champions on every elementary and middle school campus. Moreover, the PTA has taken a stance towards health and wellness. through the job duties of the Healthy Lifestyle Chair and from promoting healthier fundraisers to planning family wellness events, parents have numerous resources at their fingertips. Thank you for your willingness to serve on our SHAC and to help make healthy the norm in Dallas ISD. For more information, please contact the Health and Physical Education Department, Barbara Johnson, Director, at 972-925-6790.